declare open the 14th session of the Open-Ended Working Group on Aging and call to order its first meeting. I extend a warm welcome to all of you.
That's what it sounded like this week in New York at the United Nations General Assembly. But this meeting is being held in a smaller conference room there, and the topic wasn't about Israel and Gaza. Instead, the week-long international conference is about aging and eventually getting the United Nations to adopt a formal binding convention protecting the rights of older persons. Among the delegates is Vancouver's Dan Levitt. Levitt used to run long-term care homes in BC and also maintained a busy career as a university professor in gerontology. But he had to give it all up, a bit reluctantly, he admits, as a condition for accepting his new appointment in April as the BC government's official seniors advocate, which gives him the ear of lawmakers in his province about issues of concern facing the million seniors he calls his bosses and their caregivers. Levitt is 55, just on the cusp of senior status. He admits he couldn't pass up the chance to push governments and now even the UN to take more seriously the challenges facing his parents' generation and soon facing his own. Things like being able to afford to age in your own home, in your own neighborhood, to be able to get around with accessible transportation, even to keep on working without discrimination.
It's critically important right now, especially, and perhaps with the baby boomers, with that rising tide in demographics. It's a critical time right now that we make sure we do everything possible to support the elders in our population.
I'm Ellen Besner, and this is what Jewish Canada sounds like for Thursday, May the 23rd, 2024. Welcome to the CJN Daily. We're a podcast of the Canadian Jewish News.
Is life really miserable for the Jews, or are we just glued to a 24-hour news cycle?
Should we be worried that so many young rabbis are coming out of seminary as anti-Zionists?
And what does Judaism say about polyamory?
If you want answers to these questions, well, we don't have any. But we do love asking them. Each week, tune into Bonjour Chai to hear debates and hot takes by me, Avi Feingold,
and me, Phoebe Maltz-Bovey,
as we sit down with pundits, rabbis, and scholars to talk about the most pressing issues facing Jews in Canada and around the world.
Listen and subscribe to Bonjour Chai at thecjn.ca/bonjour or wherever you get your podcasts.
BC was the first province in Canada to create an advocate for seniors issues about a decade ago, and only 2 other provinces have similar jobs, New Brunswick and Newfoundland and Labrador. But the concerns of seniors have been in the news recently in Canada in a big way, as the federal government just launched a national subsidized dental care plan for seniors and a national pharmacare program, too, to help with the high cost of prescription drugs. And pensions are also being adjusted. But BC's new seniors advocate, Dan Levitt, says a lot more is needed, especially because inflation is making it hard for folks on fixed incomes to afford housing, food, and more. Levitt comes by this vocation honestly. His father, Ken, used to run Vancouver's Louis Breyer Jewish long-term care home. His son says the new job comes at a time when experts predict soon 1 in every 4 Canadians will be over 65, meaning big pressures on health systems, on the workforce, and more. I spoke with Dan Levitt before he left for New York.
Great to be here. Nice to meet you.
So you should tell our listeners you're not in Victoria, which is where the ledge is, or you're home in Vancouver. Where are you and why?
So right now I'm on the northern tip of Vancouver Island in a little town called Port Hardy, which is right on the Inside Passage. Some of your listeners may have cruised up here on a Alaska cruise out from Vancouver. I'm here meeting with seniors and with service providers and even the district council of Port Hardy. I'm on a tour of the province of BC right now to learn about what the biggest issues are facing seniors. And then we'll be issuing a report on our findings and making recommendations on systemic issues that impact on older adults in our province.
You've been in this field for 3 or 4 decades already, 3 decades. What are you expecting to hear that you don't already know? Or what have you heard that you don't already know?
It's a good question. I've been working for, as you said, for about 30 years, really running retirement and long-term care organizations. I kind of sucked my teeth into it, working at Baycrest Centre in Toronto for a couple of years. And I've been in BC most of my adult life working in the sector and doing international work also. But so what don't I know? I hadn't had a lot of exposure to the challenges of low-income Canadians and older adults, and realizing how they're struggling. And that's a big part of this Office of the Seniors Advocate in BC, as well as the other offices that exist around the country, is looking at how are we supporting seniors who are on fixed incomes and who are facing, as many of us are experiencing, the affordability crisis and housing crisis. And certainly as you get older, you have more healthcare needs and those expenses go up. So those are things I'm really getting exposed to and trying to understand and figuring out what are the best policy decisions that government can offer that would alleviate some of those financial pressures and improve the quality of life for older people.
The seniors in Canada now have, some of them in ages have qualified for a dental benefit. There's just been an announcement of pharmacare. The old age security pension went up this year. So, I mean, the federal government seems to be seized with making life better for people on fixed incomes who have to get their teeth fixed and get drugs and don't have, subsidized plans. Those three things, what do they signal to you about how seniors' issues are at top of mind in federal, at least, government?
Well, I think it's good news when you have the pensions going up. It's still, the pensions are not increasing at the same rate as the cost of living, especially around rents. Rents are going up dramatically, especially if somebody loses an apartment, a rental apartment, has to go into a new one. They're not going to be able to find a rent, very unlikely at that lower level unless it's a government subsidized housing project. And then the dental program is good news. We're still looking for more information exactly what that means. And I think there's some challenges, I understand, trying to find a dentist who is providing and offering that billing rate. Same thing around pharmacare. We want to see that older adults have those medications that they rely on. And as we know, as we get older and we have chronic conditions, sometimes we're on, you count the number of fingers you have. You could be, it wouldn't be unusual for an older adult, someone 85 plus, to have 10 different medications. And if you're paying for some of those out of pocket, you want to make sure that those are covered by that pharmacare plan. So those are the critical things that we want to see that they're covered. And we like seeing announcements. We're happy about that. We like seeing the spotlight shined on older adults, but we really want to make sure that the actual policies are making a positive impact on the lives of older people.
People may not realize, who are just looking at Canada's population, is the proportion or the percentage, you can look either way, of seniors in our country right now, and it's growing. Can you tell people how many out of four are seniors? Would they be even surprised to see that?
Yeah, so it's an interesting demographic shift. And I remember years ago reading a very popular book, Boom, Bust, and Echo, and realizing that there is this demographic thing happening in Canada. The baby boomers the oldest baby boomers now are 78 years of age. And what happens at 85, that's when things start to change. So at 85 years of age, it seems like 1 in 3 older adults require care either at home or they're living somewhere. And only 4 to 5% of the population at any one time over 65 is actually in care. So majority of older adults are living independently. But the other third of those people are providing care to that person, their spouse, usually a friend, and they're supporting them either at home or in that assisted living or long-term care. The other third never step foot in a care home. They're dancing and romancing, and they wish the music would never stop. But it is that demographic, that 78-year-old that we have to prepare for, and it goes from 58 currently to 78. That's the baby boomers. When they hit those numbers, I think those ages, it's going to change dramatically what the expectations are. And that's something that I think is going to disrupt and aging and kind of force us to rethink how we're caring and supporting older adults in our communities.
I don't know if this is ageism to ask you. So full disclosure, we're going to talk about ageism. How old are you? And where do you fit into this demographics? So
I'm glad you asked. I'm turning 55 on Earth Day is my birthday, April 22nd. Some of your listeners some of us cringe our birthdays. And it's interesting. If you don't feel that way or don't feel validated by what I'm saying, all your listeners have to do is go to where they buy their greeting cards. And they'll see ageism down that line of cards. And you go to the humor section, all the birthday cards that I've looked at up until the age of 29 are happy. They're fantastic. You've just turned 16, sweet 16. 19, you have new privileges. At 21, we can go to Las Vegas and have a great time. And then by the time you get elderly, oh my gosh, you're no longer able to get off the sofa. You have bathroom issues. Forget about being intimate with anybody. Forget about hope for the future. It's all negative. And I think that's ageism. And if you think about the Human Rights Code, those protected groups, imagine another protected group being discriminated against that way, and those cards being sold at a retail store in Canada. And what's shocking to me is people still buy them, and they're being bought by older adults. So there's a group of people that think that's funny, and their friends think it's funny. And I don't think those people are trying to offend or be ageist, but in fact, they clearly are. But when you compare it to other isms, it's probably the last ism, or one of the last isms, that we still, for some reason, accept, and we shouldn't. And by the way, it's not ageist to ask someone their age. But I do want to, but I appreciate you qualifying that.
You've written a lot about this ageism, yet ageism is one of the things you're not allowed to discriminate against. It's illegal. Why do you think that seniors need more protection? And I'm asking this because we're speaking as there's a current campaign this week to get the United Nations to adopt a convention, right, to protect the rights of older people. Why do they need this protection if it's already enshrined in our Canadian human rights law?
There's a convention for the rights of young people. There's a convention for the rights of women. There's a convention for Indigenous populations. And we need one also for older people. Because we're seeing around the world, we're seeing challenges with the way that government policies impact on older people. And I think it's critical that Canada, for example, and other countries that are showing leadership around how they treat and how they support older adults, that we can be exemplaries and encourage the rest of the world to uphold those standards wherever we are.
Okay, so the position, Dan, is an advisory position, an advocacy position. You got quite a big staff, 17 people. That's more than Canada's special envoy to combat anti-Semitism has. But it's not at the cabinet table. And I want to explore that a little bit. Some provinces have ministers for seniors. Ontario does. Raymond Cho, he's 87. The federal government combined seniors and labor. Seamus O'Regan. Where do you think this shows that BC prioritizes seniors if you're not at the cabinet table?
So our job is to look at government policy and to comment on it in terms of its systemic impact on older adults. We look at policies across the board in 5 areas: in healthcare, and not just long-term care, but healthcare generally, in primary care, access to physicians, access to hospital care, things like vaccinations and medications being covered. Then we look at things like housing, and not just housing for renters and the subsidies for renters, which is critically important, especially for low income. But we also look at things like property tax deferral, look at other programs that can support seniors wherever they are. We also look at transportation. And not, you lose your license at some point, and how do you then get around? Is transportation adequate for older adults, and how does that relate to loneliness and social isolation and social exclusion? Then we look at things like income, and you mentioned earlier on about the federal pensions and other provincial programs that provide income for seniors, and including also benefits that you might have, pension plans that you might have got through employment. And lastly, we look at just general community supports and things like home care and those services that are available, things like senior centers. So we look at across the board, and then we comment on those in terms of recommendations to improve the quality of life for older adults. So not being at the cabinet table, I think, is an advantage because we can be independent, and we are independent, and we can comment, and we don't have to kind of go along with, if you will, the party line.
So can we talk specifically about what you just lived through in the last few years when you were in charge of a seniors complex during the COVID pandemic? Is it Tabor or Tabor?
If you were speaking Hebrew, you would say Tavor, which is a mountain in Israel.
Right, true. But it was a Christian house. It was a Christian residence. It wasn't a Jewish residence. It did have one of the largest outbreaks in Canada of COVID. Sadly, you lost about 25, 26 residents and 100 staff and members and patients got sick.
It was one of the most challenging times for all of us, and certainly places like Tabor were ground zero for the pandemic.
So what lessons have been learned? Has it improved at all?
What it did at the time was it put a spotlight directly on long-term care and on older people. Things like should family members be separated from their loved ones in care? I think that's a question that we struggled with at the time, and I can't imagine ever again that happening. I can't imagine ever again a senior not being able to go to hospital when they need to go to hospital, or when they feel like they should go to hospital like the rest of us. I can't imagine people being, if you will, kind of stuck in their rooms because there's a pandemic going on inside the building. So there are some things like that we did to go after safety first versus independence and choice. So I think that's something we've learned a lot from that. It's been well documented. And I think kind of going forward, we know that the kind of environments where seniors were living, those long corridors, the kind of the institutional hospital-style care home, I think those, we have to look at those, count them up, and replace them. And I am encouraged to see provinces like Ontario replacing and building new 60,000 long-term care beds.
One of those things that people may have heard of, speaking of the different styles of homes, is the butterfly model. And it is catching on in mostly Scandinavian countries as well. But where in Canada are we seeing these kinds of, as you mentioned, different models for how seniors can live?
So one example is a place called Sherbrooke in Saskatoon, and where they, for decades, have had these small households where seniors live together in, maybe 12 or 14 people living in one household. Everything is contained within that household, is decentralized. The food's made in that neighborhood. The people who live there get to choose what they eat, when they want to eat. They spend the days the way they want to, and only those people who are necessary to enter in that space enter there. And there's a movement called Greenhouse, which came out of, as you described, kind of a butterfly or an Eden alternative approach created by a geriatrician out of New York State named Dr. I'm forgetting his name for a second, Bill Thomas. And regardless at the end of the day what the environment is, it's really the care. Care is probably the most important thing. You could have, if you will, the Taj Mahal, but not have, great care, or vice versa. You might have fantastic care in a so-so environment. So that's really the key thing is, what's the food like? What are the smells like? Is mom or grandma, is she treated like her family would treat her? And hopefully better.
Are nursing homes any safer now, it's 2024, than during the pandemic?
Absolutely, they're safer on a whole. Infection control was something we did off the side of our desk. The mask mandate in British Columbia for this respiratory season just got lifted, and our Minister of Health basically said, expect that next year. So these were kinds of things that we didn't see on a regular basis, and the rate of vaccinations has increased. Also, from that point of view, I think we're doing a much better job around safety for care homes.
You didn't just say, I'm having a senior moment when you couldn't remember the person's name. I say that. Can you walk me through your thoughts on this?
Yeah, so there are things that we say that are clearly ageist. And I want to be clear on something. If you said an athlete is, a tennis player at 45 is not the same tennis player they are at 25, and you can say exactly why, I don't think that's ageist. But I do think what's ageist is using terms like senior moment. If the listener thought about something, a similar term that would discriminate against someone based on their race, religion, their gender, or other factors protected under the Human Rights Code, we probably wouldn't laugh, and we'd probably be very offended. But for some reason, the term senior moment is okay for some people. I don't think it is at all. I hear it less and less. I definitely don't hear it publicly by public officials or in media.
Right. So we do this to ourselves. But I'm asking as well because in November and right now and to your south in the United States, of course, the whole media focus is on two senior candidates for president. But is that a good thing that people are actually focusing on the abilities of seniors to lead major countries? What do you take on this?
I have a very strong opinion about this. I think anyone for any job age is not a factor. Yes, we appreciate that there's a runway in life. If you think about the average life expectancy, if somebody is in their 90s, they definitely are on the other side of the curve. When Iris Apfel, who was 102 when she passed away, the fashionista, I was very sad, but I wasn't shocked that a 102-year-old would pass away. So I think we should actually be only concerned, from my perspective, about if they were to die in office, who's going to be the vice president, which vice president would most likely could lead the country well. That's perhaps from an American viewpoint. I don't have any concerns myself about age, because I think it is a discriminatory factor. Now, what we have to think about is in Canada, for example, if a 75-year-old is still working, hopefully it's by choice. Hopefully it's not by most of us want to feel valued, and we get a lot of our self-identity and self-worth from our work. I hope people aren't working because they have to pay the bills.
One of the things that you've written about is the shortage of labor in Canada. The government is very concerned with it, and they are saying now that perhaps having seniors in the workforce is an important pool that people should now be considering.
Well, I think likewise we should be encouraging older workers to be in the workplace. We shouldn't be discriminating against workers of any age. And by the way, the younger people in the workforce report more ageism than older people report. So it goes both ways. It cuts both ways. Think of other iconic people that are continuing to work. I'm going to see the Rolling Stones later this year, and you think of the age of Mick Jagger, etc. No one's questioning his ability. And by the way, if they do question his ability, you usually hear someone saying, "Oh, he can no longer hit the high notes." And when I see the person in the lineup behind me who said that, I'm not sure if they can hit the high notes either. Some people have put a lot of weight and their financial investments into companies like, say, stocks like Berkshire Hathaway. Look at the age of Warren Buffett. No one's asking him to retire, taking away his license, and the last thing he's probably getting for his birthday is a sweater. So I just think we should be encouraging people of any age to be in the workforce. And it actually, if you think about the workforce and age, it's no different from my point of view than diversity of any kind. We're big on diversity, and we got to make sure we're talking about diversity, equity, inclusion, and belonging, that we include age, because it gets lost in that conversation.
Lastly, you spoke about diversity, but I want to speak a little bit from the Yiddishkeit point of view. Do you know what number commandment, the thou shalt honor thy father and mother? Oh, you know. Okay, our listeners can't see, but can you say it audibly? You already held up your hand. What number in the order is thou shalt honor their mother and father?
Number 5.
It comes after the big ones, I'm the only God, no idols, and keep Shabbat. Way before murder is honor thy parents. Can we talk a little bit about what this means to you in terms of your philosophy towards this?
Well, it's everything. I mean, this is the most important commandment from my point of view. I appreciate the other 9. But for me, when I see the 10 commandments in synagogue, or when I think about them, and I think about, any cultural group has some kind of mission statement or values that are about protecting older people. For me, that's what my life course has been about. It's everything. And interesting. So we should be valuing, if you will, the grandparents of our society. I mean, that's the bottom line. When we look at any government policies or just what's happening generally in society or in the cities and the communities where we live, how are older adults faring? Are they visible? Can they get around the cities? If you walk into a store, do you have to use technology that maybe I don't use as well as other people? So how are we treating those people? And I think when we think about that one commandment, we should be honoring them, not patronizing, but to be honoring them in a way that they are equal society members amongst everyone else. And that things, for example, like the color of our hair, that we choose to have the color of our hair, not because we want to fit in or because we have the social norms, but because we are proud to have the color of the hair we have, and to feel okay about owning our age. That's what I'd love to see, is that perhaps in BC, where I'm working, I'd love to see that there are more gray-haired people than anywhere else, that we're simply proud of the people we are.
You were very vocal on Lisa Laflamme's firing.
No, I'd love to have a conversation with her, for me, what's trying to find that word, the oxymoron, whatever, the juxtaposition, the
irony.
The irony. Thank you. The irony is that her predecessor, Lloyd Robertson, had gray hair for a long time, and then on CBC, Peter Mansbridge had even less hair, and they kept their jobs. They were able to retire, but Lisa LaFlamme changed her hair one day, and that was it. I don't know all the details, but on the outside looking at it, it appears like ageism and sexism. And I think that was quite disturbing to me then in Canada. And you just think about what kind of message does it send to people?
You don't dye your hair. Anyway, that's the end of our time. It's been a pleasure. You know what? We'll have you come back regularly. We'll be happy to have you. Thanks so much for being on the CJN Daily.
Anytime. Thank you.
And that is what Jewish Canada sounds like for this episode of the CJN Daily. The Daily is produced by Zachary Judah Kaufman. Our executive producer is Michael Freeman. And our music is by Dov Beck-Levine. Thanks for listening. We'll be back on Monday.
Y'all remember that joke from Airplane? The old lady asked for some light reading.
How about this leaflet, famous Jewish sports legends?
But in actuality, that's changing. Jews are crushing it in sports around the world, and we are here to celebrate them.
Sandy Koufax gets his 10th strikeout.
Zach Hyman, his first career hat trick. 41 points for Diddy Avdia. It's Sue Bird's building.
I'm Gabe.
And I'm Jamie.
We love Jews and we love sports, but most of all, we love kvelling over Jews in sports.
Together we host Menschwarmers, the longest running Jewish sports podcast in the world. Listen and subscribe at thecjn.ca and wherever you find your podcasts.